Hi friends, in this video I will show you my approach of two-step Rhexis in an intumescent cataract. As you can see, we start the case. I always put the visco over the cornea. We have planned a 2.8 mm incision, posterior limbal, 3 planar. It gives a watertight wound. My tunnel length, I try to get at least 1.5 to 2 mm. My keratome has a mark which shows the 2 mm length. It helps in creating the proper tunnel. Pushing air inside. Now it's time to stain the anterior capsule with blue ring. In these cases, you must stain the capsule. Pushed phenocaine, as the case was in topical. It gives a dilatation and anesthesia also. I'm using HPMC 2%, no cohesive visco. If you are planning a two-step Rhexis, the HPMC 2% is sufficient. Using a cystitome made of 26 gauge needle. First we will make a small Rhexis, the mini Rhexis. Flap is raised. We'll try to make a Rhexis of 2 to 3 mm size, that is sufficient as the first step. You can see here we are able to make a Rhexis of almost 3 mm. Depending on the lenticular pressure, you can decrease it also up to 2 mm also. Now I use Simcoe to wash the liquefied cortex from the back and decrease the intralenticular pressure. As you can see, we are trying to aspirate the cortex. We have zoom. Here we are doing a capsular massage also in between. You can see this capsular massage helps to express out the peripheral cortex. The flow should not be very high because it can increase the capsular back pressure. So the botulite should be less during wash through the Simcoe. Now again we push the visco. It's time to go for the second step using a Vanas. We are creating a radial cut. It should not be a straight cut, otherwise it will extend to the periphery. You can supplement with the visco HPMC 2%. You can see the margin of the second flap. Now we will be using a Capsulorhexis forceps and we'll start the second step of the Rhexis. You can see we are applying a shearing and a tearing force combination and trying to get a Rhexis of 4.5 to 5 mm. Here are few air bubbles. You can see my view is blocked. So you should always clear your view because a small mistake can lead to sudden extension of the Rhexis. Now again we can see the edge of the running Rhexis. Should make it in small steps again and again, holding the Rhexis flap, and we are able to complete the Rhexis of almost 5 mm.